Hello guys, welcome to Health Program Planning and Evaluation. In this first lecture of the class, we'll be looking at an introduction to public and community health evaluation, which should be essentially an overview of all that you'll be learning in the course of this class. So these are the learning objectives to describe the links among community assessment, program implementation and program evaluation, describe pre-assessment evaluations, identify the uses and approaches of evaluation, list the principle of community-based participatory research, explain the ethical and cultural issues in evaluation, and describe the value and role of stakeholders in evaluation. Essentially, public health may be assessed by the impact it has on improving the quality of the life of people and communities through the elimination of or the reduction in the incidence and prevalence and rates of disease and disability. It should improve conditions and access to resources for healthy living for all the people in a community. And public health programs and policies may be instituted at the local, state, national, or international level. The Institute of Medicine's Committee for the Study of the Future of Public Health defines the mission of public health as fulfilling society's interests in assuring conditions in which people can be healthy. And so public and community health programs and initiatives really exist to do good and to, in a way, address social problems or to improve social conditions. So public health interventions are geared towards addressing social problems or conditions by taking into consideration the underlying factors and core causes of these public health problems. So within this context, program evaluation determines whether public health programs and policy initiatives have succeeded in improving the health and quality of life of the people. And so evaluation is often referred to as an applied research. Using the word applied in the definition lends it certain characteristics that allow it to differ from traditional research in significant ways. And so comparisons of evaluation and research have been associated with a variety of disciplines and approaches. And some approaches to evaluation, such as those that rely on determining whether goals and objectives are achieved, assess the effects of a program. And in the judicial approach, it asks for arguments for and against the program, and program accreditation seeks ratings of programs based on a professional judgment of their quality. On the other hand, the consumer-oriented approaches are responsive to stakeholders and encourage their participation. So public health program evaluation utilizes the most appropriate approach for answering the research question, including drawing on social science theories. It incorporates the use of the initiative's theory of change. This is an example of some of the terms that you would come across in the course of this course. And theory of change. So a theory of change hypothesizes clear and logical links among a program's mission, goal, objectives, and activities. So this table summarizes differences between evaluation and traditional research. Evaluation is about a particular initiative. It is generally carried out to assess the initiative, and the results are not generalizable. However, with the scaling up of programs to reach increasingly large segments of the population, and with common outcome expectations and common measures, evaluations can increase their generalizability, but generally, yeah, they don't have that generalizability feature. Research traditionally aims to produce results that are generalizable to a whole population, a whole place, or a setting in a single experiment. Evaluations are designed to improve an initiative and to provide information for decision making at the program or policy level. On the other hand, research aims to prove whether there is a cause and effect relationship between two entities in a controlled situation. Another difference is that evaluation questions are generally related to understanding why and how well an intervention worked, as well as to determine whether it worked. On the other hand, traditional research is much more focused on the endpoint, on whether an intervention worked, simply just whether it worked. Another difference is that evaluation questions are identified by stakeholders. It is more like a collaborative effort with stakeholders working in collaboration with evaluators, as opposed to what we have in traditional research, where the research questions are usually dictated by the researcher's agenda. Evaluation has been described as the use of social research methods to systematically investigate the effectiveness of social intervention programs in ways that are adapted to their political and organizational environments. And they are designed to inform social action and to inform social conditions. It provides the best information possible under conditions that involve political process of balancing interests and reaching decisions. Evaluation, we can say, is the cornerstone of improving public health programs and is conducted for the purpose of making a judgment of a program's worth or its value. It incorporates steps that specify and describe the activities and the process of evaluation, the initiative and why it is being evaluated, and the measures needed to assess inputs, outputs, and outcomes. Again, these are some of the terms that you would, in the course of this class, get more acquainted with. Evaluation also talks about the methodology of collecting information, data. And in addition, an evaluation analyzes data and disseminates results in ways that ensure that the evaluation is useful to the stakeholders. So let's look at the link between community assessment, program implementation, and evaluation. So there is a 5-step process of program implementation, of program planning, implementation, and evaluation. When a community or an individual identifies a public health problem among a population, steps are taken to understand the problem. These steps constitute community assessments, which define the problem using qualitative and quantitative measures. And they assess the extent of the problem, who is most affected, and the individual and environmental factors that may be contributing to or exacerbating the problem. And community assessments determine the activities that will potentially lead to change, the factors that put the population at risk of disease and or disability. So programs are planned and implemented based on the findings of the community assessments and the resources that are available within that population group or within that community. So the term initiative is used in this class to refer to a program or policy intervention that addresses the health or social concern. And so details about conducting a community assessment and developing initiatives and will be discussed later in the course. So examples of initiatives are a program for low-income families to increase their knowledge and skills with regard to accessing healthcare, and an after-school program to improve physical fitness. So programs may also modify the environment to improve access to conditions that support health, such as improving conditions for taking walks in a community, or improving access to fresh produce, farm produce. Initiatives can also develop or change public policy so that more people have health insurance and improved access to healthcare. An initiative may have multiple activities, programs, or policies in one. So, an example is the prevention of the onset of diabetes, which requires a multi-pronged intervention for those at risk. Individual components that constitute the initiative may include physical activity, diet control, case management, outreach education, and policies that increase the availability of fresh produce. So it is imperative to determine the effectiveness of these initiatives um, by conducting program evaluation. So evaluating a multi-pronged initiative requires assessing both processes and outcomes for each component, as well as assessing the overall effects of the initiative on preventing diabetes, for example, among the target population. So evaluation activities may occur at multiple points on a continuum, from planning the initiative through implementation to assessing the effect on the populations served, and meeting the goals outlined in the healthy people objectives, for example. The healthy people documents identify the most significant preventable threats to health, and establish national goals to reduce these threats. These documents can actually serve as a framework or a baseline for which to design public health related interventions in any community. So individuals, groups, and organizations are encouraged to integrate the healthy people objectives into the development of initiatives of any kind. In addition, businesses can use the framework to build work sites, health promotion activities. Schools and colleges can undertake programs and activities to improve the health of students and staff. Healthcare providers can encourage their patients to pursue healthy lifestyles. Community-based organizations and civil and faith-based organizations can develop initiatives to address health issues in the community, especially among hard-to-reach populations, and to ensure that everybody has access to information and resources for healthy living. So, determining the effectiveness of the implementation of programs and policies and the impact of such initiatives on the population that is reached is the task of program evaluation. Although evaluation activities may use different approaches, their function is similar across disciplines. So in phase one, let's look at these phases in more detail. In phase one, which is the needs assessment, a target population or a setting is identified for assessment and possible interventions. So ideally, it is not predetermined by political or financial agendas, but rather by what is called perceived needs. And that, of course, the actual need will be, which is more objective, will be determined by the assessment. And so, but that idea of what the perceived need of that population is what, first of all, instigates that initial move to do a community assessment. So in this phase, an assessment is conducted to determine the problem issues in that population. And these assessments can be focused on one or all of these areas, individual, social, network, or community. It could be targeted at the system or infrastructure, or on the fourth level, the society. Secondary data, which is data collected for another purpose, and primary data collected directly for these assessments, usually through interviews or surveys, are both used to evaluate the problems and strengths of the identified target system or group. And after critically evaluating the information collected, the most important and realistically changeable issues are targeted for interventions. The information that we gain from conducting an assessment is used as a baseline for comparison in post-intervention. And so this is one of the most crucial steps. Without clear baseline measures, it is practically impossible to evaluate the impact of any intervention. A measurable baseline or program goal is usually determined by group consensus. The baseline goal may mirror national or international health goals on the issue, such as healthy people, like we mentioned initially, or the sustainable development goals. And like here we have an example. Imagine we have baseline data which shows that 20% of males ages 19 to 25 in X city smoke a pack of cigarettes per day. The baseline goal could then be that by the 31st of December 2027, 10% of males ages 19 to 25 in X city will smoke a pack of cigarettes per day. Or to put it in a way that gives direction, we could say to reduce the proportion of males ages 19 to 25 in X city who smoke a pack of cigarettes per day by 50%, by the 31st of December 2027. So the statements of the baseline data and goal have similar language, if you notice, implying that they will be measured using the same methods. So they are worded in a way that can be answered with a yes/no response in relation to whether they have been achieved or not. In phase 2, which is program planning, after the focus of the program is determined, the pre-program evaluation, which is an aspect of formative evaluation, may be needed. So this phase is a back and forth process where more in-depth information is gained on the targeted population, and specifically on issues that are highlighted for intervention. And so formative evaluation is developmental in nature, and it answers questions about whether the program should be implemented as designed, whether it should be modified to make it perform better, or if it should be completely discarded. And so early formative evaluation is key to designing programs that are more likely to succeed, keeping programs on course for success, and ensuring that programs that cannot be salvaged are closed down before they lead to unnecessary wastage. A program goal is constructed along with measurable program objectives, and these are created and refined as specific interventions are assessed and created. So the most effective interventions for a specific topic or population or a setting are researched through a critique of the literature, through stakeholder interviews, and further formative research. Resources, for example, personnel, money, time needed, may limit what interventions are feasible in a particular setting. And the overall program goal reflects the intent of all interventions. So, in the smoking example that we mentioned earlier, the final program goal may become to decrease the prevalence of smoking in males ages 19 to 25 residing in X city from 20% to 15% by December 31st, 2027. So program objectives reflect the type of interventions and the expected outcomes from these interventions that will cumulatively result in a decrease of 5% prevalence of smoking that we have set out to achieve. So objectives start broadly with each intervention and move to specifics if the intervention is complex. So measurable objectives provide the foundation for clear evaluation questions and processes. And we will see examples here. We see examples of program objectives. This is like trying to get you set for the more work that you will do in fashioning objectives later in the class. Um, so for that, our broad program of trying to tackle the issue of smoking, we can have examples of objectives, which includes to give free tobacco counseling education to at least 1,000 males ages 19 to 25 residing in X city by December 31st, 2026. Notice that the focus of this objective is on the individual. Another objective could be to organize a tobacco awareness campaign focused on the effects of secondhand smoke and targeting families in X city with a member who smokes by December 31st, 2026. This intervention focuses on family members and the community as a secondary audience that may influence smoking behavior in individuals. The third objective could be to distribute 100 nicotine patches to each of the 10 clinics in X city by December 31st, 2026. This intervention focuses on systems. And then a fourth objective could be to get employers in X city to implement the recently passed policy that bans smoking in public places in X city by December 31st, 2025. So this societal intervention controls the environment and is removed from the individual and family, but may control smoking behavior. So cumulatively, this multi-pronged intervention in X city may affect the overall health status of the population and thus reach the overall program goal of decreasing the level of smoking in the population group by 5%. So the overall impact of the program, if successful, matches the baseline goal and ultimately affects further baseline readings. So after an intervention plan has been designed, evaluation questions, methods, and standards for success should be constructed. And evaluation questions and methods flow from the objectives, and we'll discuss these more later in the course. So in phase 3, the program interventions are implemented and revised and based on process evaluation. When thinking about implementation, it will be important to draw on all you know about planning, managing, and leading change, which can be a very complex and challenging task. And so process evaluation, also known as monitoring, is a specific type of formative evaluation that occurs as the program is being implemented. So it answers questions about whether the program activities are being performed as expected. So process evaluation does not look directly at the outcomes of those activities, but like other aspects of formative evaluation, it can help identify barriers to success and serve as an important barometer of whether the program is on course to achieve success. So process evaluation, utilizes both quantitative and qualitative methods, but qualitative methods are used more extensively, since the questions are often around why and how. So implementation evaluation should be informed by implementation theory and implementation strategy. There are some concepts you also learn more about later on in the class. We move over to phase 4, and which we'll talk about outcome and impact evaluation. So outcome evaluation is done immediately after an intervention, or at the end of a key phase in the intervention if the program is complex. So it assesses the intervention's effects on the targeted population in terms of change in knowledge, attitude, practice, or access to healthcare, for example. So mixed methods are used, but there is a growing emphasis on quantitative methods. And impact evaluations are done further out in time, usually after 1 year, and assess changes in the baseline and targeted health status of the population or the status of the health system. So this shows the effectiveness of all the interventions, is the overall the culminating effects of that program, that health program. So quantitative methods like surveillance and monitoring data are used most often to establish the final impact of a program. And population level data is used for comparison between before and after interventions. So the term summative evaluation typically refers to outcome and impact evaluations, but it may sometimes be used to describe process evaluation, depending on the scope of the work. In contrast to formative evaluation, summative evaluation is not primarily developmental in nature, but rather focuses on assessing the end results of a program. So this is one of the major areas where terminology is inconsistent across regions, from country to country, across disciplines, and so on. So often the terms impact and outcome are switched, and you may notice authors using them differently or interchangeably. But for this class, please stick to the definitions provided in this lecture, where outcome evaluation is immediate assessment of the effects, and then impact evaluation is assessing the effects in the long run, and summative evaluation referring to impact and outcome evaluation, and formative evaluation having to do with pre-program evaluation and process evaluation. And then finally, phase 5, which focuses on disseminating the evaluation findings and replicating the program in similar settings if it is shown to be effective. So there will be more on this again much later in the course. So let's use this figure that illustrates the context of evaluation to recap what we've said so far. Formative evaluation is the appropriate approach during program planning and development phase of an initiative. Process evaluation, also known as monitoring, is used during the implementation phase, and when the goal of the evaluation is to understand what went into the program and how well it is being implemented, of course, also part of formative evaluation. And then outcome evaluations are carried out after the programs have been in place for a time and considered stable. Such an evaluation can assess the effect of a program or policy on individuals or a community. So outcome evaluation aims to understand whether a program was effective and if it has achieved what it set out to accomplish. And impact evaluation is the last stage of the evaluation continuum. It is used when multiple programs and initiatives affect the quality of life of a large population over a long period of time. So multiple interventions on the population or subpopulation are assessed for changes in quality of life and for the incidence and prevalence of disease or disability. Let's quickly look at what we call pre-assessment evaluations. One major assumption in evaluating an initiative is that it was well planned and fully implemented. Um, this, however, is not always the case, and the evaluation team may then find that it must balance the expense associated with undertaking the evaluation with the likely results of that evaluation. So the question becomes, in undertaking this evaluation, will we be able to provide useful information to the stakeholders for decision making or program improvement? If the answer is no, then the initiative may not be ready for an evaluation. And if the answer is yes, consultation may be necessary, with regard to various aspects of the evaluation, for which stakeholder participation is critical. Pre-assessment therefore may be thought of as a kind of feasibility study of the initiative's readiness to be evaluated. Um, and components of a feasibility evaluation may include assessing the readiness of executives, staff, and stakeholders to support an evaluation and to welcome or use the results of that evaluation. It could include determining whether the stated goals and objectives are clear and if they reflect the intended direction of the organization. Also, it may mean assessing the logic of the program and its ability to achieve the stated goal and objectives, given the initiative's activities and resources. Also, it could mean assessing whether data collected or the program's implementation activities are likely to be suitable for showing the effects of the program. It also involves assessing whether processes exist or can be developed, to provide sufficient information to assess the program's activities, in outputs, and outcomes. Again, some key terms that you have to and you definitely need to know their specific definitions in the course of this class: activities, outputs, outcomes, impact. Pre-assessment evaluation could also mean assessing access to program participants, program staff, and other stakeholders, assessing the logistics and the resources available to conduct an evaluation, and whether pre-assessment is completed formally or informally. The outcome may be either that the evaluation is able to go ahead or that it has to be delayed until various conditions are met. So meeting the conditions may require anything from developing a set of data management and evaluation tools that allow for appropriate and adequate data collection, to taking far-reaching measures such as collecting baseline data and restructuring the entire initiative. So such actions ensure that the program has the components and tools essential for undertaking an appropriate and meaningful evaluation in the future. So one of the detailed tasks in carrying out a pre-assessment is to work with the organization involved to understand the contexts and programs, the epidemiological and community database rationale, and the resources for the intervention. So the evaluator identifies the intervention components and creates a theory of change model and determines the existence or non-existence of specific, measurable, realistic, achievable, and time-oriented short-term, intermediate, and long-term outcome objectives. So let's look at community-based participatory research in program evaluation. A fundamental principle of evaluation is that the evaluation team has a responsibility not only to the profession but to the community. So the American Evaluation Association reminds us that evaluators articulate and take into account the diversity of general and public interests and values, and thus should, number one, include relevant perspectives and interests of the full range of stakeholders when planning or executing an evaluation. Two, evaluators should consider not only intermediate operations and outcomes of the evaluation, but also the broad assumptions, implications, and potential side effects. They should also allow stakeholders access to and actively disseminate evaluative information and present evaluation results in understandable forms that respect people and honor promises of confidentiality. And fourthly, evaluators should maintain the balance between client and stakeholder needs and interests. And number five, take into account the public interests and good, going beyond the analysis of particular stakeholder needs and interests, to consider the welfare of the society as a whole. A participatory model for evaluation views evaluation as a team effort that involves people who are internal or external to the organization with varying levels of evaluation expertise, in a power sharing and co-learning relationship. So 9 principles of participatory evaluation, have been identified. And number one is the process involves participants in learning skills. Number two, participants own the evaluation and are active in the process. And three, participants focus the evaluation on what they consider important. And number four, participants work together as a group. Number five, the whole evaluation process is understandable and meaningful to the participants. Number six, accountability to oneself and to others is valued and supported. Number seven, the perspectives and expertise of all persons are recognized and valued. Number eight, the evaluator facilitates the process and is a collaborator and a resource for the team. And number nine, the status of the evaluator relative to the team is minimized, to allow equitable participation. So a participatory model for evaluation embraces the stakeholders in the process and utilizes approaches to help the organization develop the capacity to evaluate its own programs and to institute program improvements. So by adopting the community-based participatory research, evaluation emphasizes self-determination, learning and empowerment, and incorporates both qualitative and quantitative methods for data collection. It underscores the value of including those who have a vested interest in the programs and their communities, in the process. So the community-based participatory research approach proposes 9 guiding principles for collaboration. And these guidelines are easily incorporated into participatory program evaluation of public health initiatives. So community-based participatory research, and number one, acknowledges community as a unit of identity in which people have membership. It may be identified as a geographical area or as a group of individuals. Number two, it builds on strengths and resources of the community and utilizes them to address the needs of the community. Number three, it facilitates a collaborative, equitable partnership in all phases of research involving an empowering and power sharing process that attends to social inequalities with open communication among all partners and an equitable share in the decision-making process. It also fosters co-learning and capacity building among all partners with a recognition that people bring a variety of skills and expertise and experience to the process. It integrates and achieves a balance between knowledge generation an intervention for the mutual benefits of all partners with the translation of research and the results of research into action. And it focuses on the local relevance of public health problems from an ecological perspective, that addresses the multiple determinants of health, including biological, social, economic, cultural, and physical factors. It involves systems development using a cyclical and iterative process that includes all stages of the research process, from assessing and identifying the problem and to action. It also disseminates results to all partners and involves them in the wide dissemination of results, in ways that are respectful. And finally, it involves a long-term process and commitment to sustainability in order to build trust, and have the ability to address multiple determinants of health over an extended period of time. So important outcomes of community-based participatory research approaches are building community infrastructure and community capacity and community knowledge, and skills. So we'll look next at the participatory model for evaluation. Um, Adopted, so the participatory model for evaluation adopted for this class is the CDC program evaluation framework, which has 6 steps. It encourages the integration of community-based participatory research principles and supports a collaborative, equitable partnership, in all phases of the evaluation process. It fosters co-learning and capacity building, while acknowledging and utilizing existing experience and expertise. So it incorporates all the elements of the evaluation process, but does so in a more or less flexible and simplified way. And so it recognizes the often iterative and integrative nature of evaluation in designing the evaluation, collecting, analyzing, and interpreting the data, and reporting the findings. So it links the evaluation process to community assessment and program planning and implementation, in a deliberative and iterative way. Stakeholders' active participation in the process provides flexibility in the evaluation, and allows it to be customizable to the user's needs. This model recognizes the dynamic nature of programs and the changing needs of the evaluation over time. So hence the cyclical nature of the process. So here we see a pictorial representation of the CDC program evaluation framework. Again, so the participatory model for evaluation consists of 4 major steps: design the evaluation, collect the data, analyze and interpret the data, and report the findings. Of course, like I've said, stakeholders are part of the evaluation team and partake in every step of the process. Again, a diagrammatic representation of the participatory model for evaluation. So we use this model to evaluate public health programs or policy initiatives. And this model recognizes that the community assessments and the public health initiative are precursors to an evaluation. The participatory model for evaluation consists of 4 major steps. Like I've said initially, design the evaluation, collect the data, analyze and interpret the data, and report the findings. So in this model of evaluation, stakeholders who have a vested interest in the program's development, implementation, or results are part of the evaluation team and are involved in each step of the evaluation process. The inclusion of stakeholders in evaluation is both good practice and is of ethical significance. And so public health policies, programs, and priorities should be developed and evaluated through processes that ensure an opportunity for input from community members. And stakeholders provide multiple perspectives and a deep understanding of the cultural context in which an initiative is developed and context in which the evaluation is conducted. So we look at evaluators and their role. The evaluation team is led by an experienced evaluator who may be internal or external to the organization. Historically, the evaluator has been an outsider who comes in to give an independent, unbiased review of the initiative. But more recently, agencies and large non-profit organizations have made use of in-house evaluators, or modified the roles of staff to provide evaluation and thereby strengthen the overall capacity of the organization. So a significant advantage is that the agency may be able to have a more sustained evaluation conducted at lower cost. Irrespective of the approach used, participatory models include stakeholders as part of the evaluation design and implementation in order to facilitate the use of the findings. So there are advantages and disadvantages to choosing an internal or external evaluator. An internal person who has the expertise to conduct an evaluation and who knows the program very well may also have easy access to materials, logistics, and resources and data. However, internal evaluators are often too busy, maybe less objective than external people, and may have limited expertise. An external evaluator is often viewed as being more credible, more objective, and better able to offer additional insights and serve as a facilitator than someone from inside the organization. So an external person may also be able to provide additional resources. But on the downside, external evaluators may not know the program very well, they may not know the policies and procedures of the organization, and may not understand the program context, and may be perceived as adversarial, and maybe seen as an adversary, someone who's there to criticize and to bring down the organization, or someone who's been imposed on the organization. So whether an evaluator is internal or external, the person who has the primary responsibility for the evaluation should have essential competencies, should know and maintain professional norms and values, including evaluation standards and principles. Should use expertise in the technical aspects of evaluation, such as the design, measurement, data analysis, interpretation and sharing of the results. Should use situational analysis, understand and attend to contextual and political issues of an evaluation. The evaluator should understand the nuts and bolts of evaluation, including contract negotiation, budgeting, and identifying and coordinating needed resources for a timely evaluation. The evaluator should be reflective regarding their practice and be aware of their expertise as well as the need for professional growth. Ideally, an evaluator should have interpersonal competence in written communication and the cross-cultural skills needed to work with diverse groups of stakeholders. We'll talk more about culture and cross-cultural skills later in this lecture. Um, for five ethical principles of program evaluation were adopted and ratified by the American Evaluation Association. And these principles reflect the fundamental ethical principles that we are more used to, the principles of autonomy, non-maleficence, beneficence, justice, and fidelity. And as such, these principles provides an ethical compass for action and decision making throughout the evaluation process. So these five principles are: number one, systematic inquiry. Evaluators conduct systematic and database inquiries, and so they should adhere to the highest technical standards, explore the shortcomings and strengths of evaluation questions and approaches, and communicate the approaches, methods, and limitations of the evaluation accurately, and allow others to be able to understand, interpret, and critique their work. Number two principle is competence. So evaluators provide competent performance to stakeholders, and they ensure that the evaluation team possesses the knowledge, the skills, and experience required, and that it demonstrates cultural competence, practices within its limits, and continuously provides the highest level of performance. Number three principle is integrity and honesty. Evaluators display honesty and integrity in their own behavior and attempt to ensure the honesty of the entire evaluation process. And they negotiate honestly, disclose any conflicts of interest and values, and any sources of financial support. So they should disclose changes to the evaluation, resolve any concerns, accurately represent their findings, and attempt to prevent any misuse of those findings. And then number four principle is respect for people. Evaluators should respect the security, dignity, and worth of respondents and program participants, clients, and other stakeholders. They should understand the context of the evaluation, abide by ethical standards, conduct the evaluation, and communicate results in a way that respects the stakeholders' dignity and worth, in a way that fosters social equity and in manners that takes into account all persons. And the fifth principle is responsibilities for general and public welfare. So evaluators should articulate and take into account the diversity of general and public values that may be related to the evaluation, and then they should include relevant perspectives, consider also the side effects, and allow stakeholders to present the results in appropriate forms that respect confidentiality, that take into account the public interest and consider the welfare of society as a whole. So that second principle of competence refers to providing skilled evaluation. So evaluators should possess or ensure that the evaluation team possesses the education, the abilities, skills, and experience that are appropriate to undertake the task proposed by the evaluation. In addition, the evaluation team develops cross-cultural skills in order to understand the culture in which both the initiative and evaluation are embedded. So we look at other essential group that make up or that are part of the evaluation team, and those are the stakeholders. So stakeholders who are identified to be part of the evaluation team are individuals, groups, organizations that have a significant interest in how well a program functions. So involving stakeholders allows the initiative to be viewed in the appropriate administrative, epidemiological, political, and socio-cultural perspective. Stakeholders provide the funding for the program, they provide management, or they may be responsible for oversight, or they may be participants in the program themselves and benefit from program activities. So in addition, some stakeholders have an interest in the program but do not have any specific role in the organization and its initiatives. So it is equally important to engage those community members who are not supportive of the program and to understand their concerns and the competition that the organization faces. Involving multiple stakeholders enhances the credibility of the evaluation and ensures that the appropriate voices are heard and give stakeholders an ownership in the evaluation. A stakeholder analysis will help identify the stakeholders who are associated with a program, their interest in the program, and their likely contribution to the evaluation task. And the stakeholder analysis is conducted at the start and throughout the evaluation process to ensure that the right people are included at critical points, from developing the evaluation design to reporting the results. And during the evaluation, the roles of the stakeholders change as they go in and out of the process and participate as is appropriate for their interests and expertise. So stakeholders in the public health evaluation could include the board of directors of the organization that has requested the evaluation to determine whether the organization is meeting the requirements for continued funding. It could be the board of directors of a foundation that provides community grants and wants to be sure its grants are making a difference in achieving strategic goals. The stakeholders could include executive director who provides overall oversight and the management of the program. It could be the project manager who provides the day-to-day management of staff who implement the program or the policy. Stakeholders also include staff who are providing services to clients, staff supervising logistical services, persons receiving services who meet the criteria for the intended population sample, persons who are affected in any way by the services or policies, persons in the larger community who have an interest in the program's success. So ideally, stakeholders are involved in the evaluation from the start and throughout the process. So in addition to their invaluable inputs in understanding program development and implementation, they have critical roles and responsibilities that include providing access to files, reports, and publications, providing administrative and logistical support, and granting access to other stakeholders as necessary for data collection, and giving support in implementing the evaluation plan, and providing insights into the results and the interpretation of the data analysis. They could also give support in disseminating the interim and final reports. And so keeping stakeholders engaged in the evaluation process involves developing meaningful relationships with them. Relationship development may be facilitated by understanding some of their issues, understanding the cultural and power issues that exist, and working to develop a trusting and ethical relationship. So within the changing demographics of most countries, states, counties, cities, or neighborhood, or whatever geographical and jurisdiction you're talking about, being sensitive to other cultures is important and may make the difference between an evaluation that produces useful findings and one that does not. So that's why it's important for us to look at cultural considerations in evaluation. And so it may be the difference between having a set of behaviors, attitudes, and practices that enables effective work and not being effective at all in your evaluation. So knowing that there are differences among cultures and yet avoiding value judgments that undermine the integrity of a people is an underlying principle of cross-cultural engagement. And so appreciating and embracing cultures different from our own culture and facilitates an environment that is conducive to each person's growth and development. Um, Although there are many definitions of culture, it is generally thought to refer to a set of beliefs, traditions, and behavior that apply to a particular group of people. So cultural groups may be identified based on age, gender, religion, country of origin, race or ethnicity, sexual orientation, disability, family background, language, food preference, employment, or neighborhood community. So these characteristics influence societal traditions and they determine thought patterns, processes, and traditions. Some people have defined culture as the sum of beliefs and practices, habits, likes, dislikes, norms, customs, rituals, and so forth, and that we learned from our families during the years of socialization. So, societal customs and traditions are handed down through multiple generations and may include the way members of the group dress, sing, and dance, or how they perceive and respond to the world around them. So, traditions are passed down by word of mouth during periods of storytelling or less deliberately when societies perform traditions year after year. Native Americans, for example, have many traditions that define their culture, as do Africans and Asians, both in their native areas and in diaspora. So, certain practices are unique to a cultural group, but often we find similar traditions across groups. And so, it is fascinating to observe that Black populations that live in America, the Caribbean, and Canada have traditions that are similar to those of Blacks who live in Africa, even though they have been separated for many generations. These thought patterns seem not to have changed that much. So, as cultures have become integrated through immigration and intermarriage, we see changes in cultural practices. Societies continue to eliminate those practices that are thought to be harmful and to retain those that speak to the core values of their people. So, because culture gives people unique perspectives and often unique ways of doing things, developing the knowledge and skills to work cross-culturally is critical to effective practice when it comes to program evaluation. So it's important to learn about another person's culture and to be able to fully appreciate and consider it. And learning requires humility of spirit, openness and honesty, patience, and a willingness to share what we know with others. So culture indeed plays an important role in program evaluation, and the cultural context guides the methods and approaches that may be used throughout the process, as well as the interpretation of the results, and how conclusions are drawn. And so, as a result, culture influences the validity of the evaluation findings. So, aspects of the evaluation process that culture affects include how the evaluation questions are asked, the selection of the data sources, the methods and approaches used to collect the data, the techniques used in the evaluation, the methods and approaches used in communicating the results of the evaluation. And so, standards of cultural competence have often been used to define the expectations of those working with a diverse population. And cultural competence incorporates the hope that the workforce has the knowledge, the attitudes, and the skills necessary to understand the beliefs, behaviors, and practices of the population being served. So it is also necessary that they have demographic characteristics similar to those of the receivers of the services, or in some cases that they simply be able to provide language translation services. Cultural competence has been defined in multiple ways, and some authors have suggested that it acknowledges and incorporates at all levels the importance of culture, assessment of cross-cultural relations, vigilance towards the dynamics that result from cultural differences, expansion of cultural knowledge, and adaptation of services to meet culturally unique needs. Three characteristics are conducive to reaching mutual goals: cultural desire, which is the desire to work in a multicultural society, and then there's cultural awareness, and then cultural sensitivity. So cultural competence may be characterized as the knowledge, having the knowledge and the attitudes and the values that, when applied systematically, lead to the empowerment of others, irrespective of their culture. In recognizing the significance of paying attention to culture and valuing the inputs and expertise of others, and the American Evaluation Association's guiding principles for evaluation reads and understand, respect, and take into account differences among stakeholders such as culture, religion, disability, age, sexual orientation, and ethnicity. So to do so, one must be culturally competent. So cultural competence in evaluation means being open, respectful, and appreciative of another's culture. Acknowledging the value of other cultures, recognizing culturally based understandings, and incorporating culturally understanding into each step of the evaluation process. So cultural competence really is a journey and does not have a discrete endpoint, because we can never really become fully competent in another person's culture. And however, cultural humility and the ability to listen to people from other cultures and to evaluate ourselves are important characteristics of evaluators, who are culturally competent. So cultural competence goes hand in hand and should go hand in hand with cultural humility. So cultural humility includes understanding the impact of one's professional culture, which helps shape the relationship between the evaluator and the stakeholders. An important aspect or result of a relationship where there is cultural humility is likely to be full and equitable participation for all stakeholders. The American Evaluation Association standards includes two guiding competencies for evaluators that focus on cultural understanding. These competencies are being able to demonstrate a sufficient level of cultural competence to ensure recognition, accurate interpretation, and respect for diversity, and become acquainted with and respect differences among participants, including their culture, religion, gender, age, and ethnicity. So, in summary, evaluation is conducted by a team that consists of evaluators and stakeholders who share responsibility for the evaluation from the start of the process to completing the reports and presenting the findings. And the participatory model for evaluation considers the community assessment and the public health program or policy initiative as precursors to evaluation. And community-based participatory research fosters the involvement of stakeholders in all aspects of the evaluation, from describing the initiative's context to writing the final evaluation report. And the guiding principles for performing evaluation are systematic inquiry, competence, integrity, respect for persons, and responsibility for the public welfare. And culture refers to a set of beliefs, traditions, and behaviors of a group of people that may be identified by personal characteristics, geographical area, or common interests. And this necessitates that evaluators demonstrate a sufficient level of cultural competence and humility to ensure recognition, accurate interpretation, and respect for diversity. Thank you, and see you later in class.